Let's talk about some examples of parenteral agents of iron salt supplements. Alright, so we've been talking about iron deficiency for a while right now. And we said that iron deficiency is basically what? Reduction in the levels of iron in the body. So if levels of iron in the body are reduced, you want to actually what? Replace these levels. And in replacing these levels, um, you can administer the iron supplement through the oral route of drug administration or through the parenteral route of drug administration, which is basically what? You using the veins. Okay? Put iron in this stuff and you would do an intravenous iron therapy. So let's look at examples of drugs that you can basically administer through this intravenous route. Okay, so you can replace the levels of iron in the body. Okay, so quickly, the parenteral agents of iron salt supplement. We have the examples here, so just pay attention. Now, a colloidal suspension of what? Ferrous hydroxide and dextran can be administered by the intravenous infusion or intramuscular injection. Okay, so it could either be through the veins or through the muscles. Okay, so now parenteral agents may be useful in patients with iron absorption disorders, which are caused by what? Inflammatory bowel disease, small bowel resection, gastrectomy, or hereditary absorption. I feel like let me share more light on this. So parenteral administration of iron supplements is only useful if the patient has a problem with absorption. That means if you give the iron through the oral route, yes, to go into the gastrointestinal tract quite alright, but they'll have problems absorbing that iron. Do you understand? So you want to actually what? Administer the iron directly into the veins. Do you understand? Alright, so examples of the disease condition could be small bowel disease. Alright, so like the small intestines are inflamed. Do you understand? There's small bowel resection, like they did a surgery to remove the small intestine, maybe due to cancer or stuff. So they don't really have the small intestine to even absorb the iron, right? And the iron is absorbed in the small intestine. Then gastrectomy too is a surgery to cut some parts of the stomach. Then it could be that the patient has some absorption problems that were hereditary. Okay, so now these parenteral agents are indicated for patients with what? Hypersensitivity to reaction. Um, Patients with hypersensitivity reaction to oral iron salts. So it could be that you are giving the iron supplement or iron treatment through the veins, because if you give it through the oral route or through the mouth, the patient will react to it. That's an allergic reaction. So you want to actually just dump it in the veins directly. Okay. So you can see this was the dextran. These are dextran drugs look like. Okay. And this dextran is the drugs that you can give, right? So now these agents are useful in severe anemic conditions in which rapid correction of iron deficiency is desired. Do you know what that means? If you take the oral route of drug administration and you give the drug, it takes some time before this drug is absorbed into the systemic circulation, because this drug have to tackle with all those gastric acid, tackle with gastric enzymes, has to undergo the first pass effect in the liver and all the stuff. Do you understand? So it will take some time. Maybe when you take the drug, before you start seeing the effect, it should take like 2 hours. But if you want an ASAP replacement of iron deficiency, then you just put it directly into the veins. Okay, you bypass all those first pass effects, you bypass all those gastric enzymes, you bypass all those stuffs that should have delayed. Okay, so now parenteral agents may be used to reduce what? Toxic reactions on initiation of what? Erythropoietin. That's a epoetin alpha therapy in patients with what? Renal disease. Alright, so basically you are administering iron because for erythropoietin or epogen to act, it needs iron in adequate. It needs iron in adequate amount in the body. If it doesn't, if if you are administering this drug to somebody that doesn't have iron in adequate amounts in the body, then it will be toxic. So as you are administering epoetin alpha or epogen or erythropoietin, you are administering what? this parenteral ion. Okay, like it's acting so fast. So this is what iron sucrose injection, and this is still another type of what drug that we can use for what parenteral replacement of what iron levels in the body. All right, so these are the what examples of what parenteral agents of what iron salt supplements. See you guys pretty soon.